one study I was just reading about that had mentioned that the brains of infants who are with a mother who's depressed look very similar to the depressed mom. So, I mean, it really affects attachment, even whether it's in the womb or postpartum. So it does have some physiological consequences on the developing baby.
Hello and welcome to the Inspired Woman podcast. I'm Marcy Narum. This podcast is dedicated to impacting a multitude of women with its mission to celebrate, encourage, empower, educate, entertain, and connect women. Our May cover girl, Lea Berentson, is here today to share a little bit more of her story. Thank you so much for coming in today.
Thanks for having me.
Yeah. Thanks for being our cover girl. Your story is so incredible, and I'm just so grateful and honored that you would share it with our readers and our viewers and listeners and followers. So, and for those who haven't had a chance to read it yet, it is in the May issue. You can pick up a copy or you can read it online, inspiredwomanonline.com. And we're not going to retell Lea's story here right now, but in a nutshell, you had cancer when you were 9 years old,
Yep.
so about third grade. Broke your leg, had cancer, your leg was amputated, and then you were at a summer camp for kids with cancer. Your mom dropped you off, but the day came for her to pick you up, and she didn't show up. And you haven't seen her, right? I mean, you don't know where she is.
I kind of know relatively the, geographic area, but I don't know to this day if she's even alive. I have no contact and haven't had for many, many years.
But you're a mother of two beautiful little girls.
Thank you.
And you can see pictures of them in the article. They're just darling. Meadow and Willow.
That's right. Yep.
Yes, cuties. But having Willow was a tough go. You had postpartum cardiomyopathy. Is that right?
Peripartum.
Peripartum.
Yeah, because it does start typically in the third trimester.
Okay.
Yeah, that was
And
a scary experience.
did I cover all of it? I wrote the story, but
That's the summary.
Okay.
I mean, the very kind of bare bones.
Yeah.
Of course, there's a lot of details within that, but yeah, it's been a trying time.
But with such resilience, Lea, and this amazing attitude, and then you're turning your life and your career into helping other women going through difficult situations. And so that's what I want to talk about is where you're at now and why you chose to do what you do. So tell us a little bit about your work at Sanford Women's Medical. Is that
Yep.
right? Okay.
Yep. Well, I'm a clinical psychologist by training, and I was at another medical center for about 7 years before coming over to Sanford. I had spent a lot of time in my prior work as a clinical psychologist working with adults, mostly adolescents, struggling with a lot of different mental health concerns. And I think through my own experiences with having 2 high-risk pregnancies and experiencing firsthand the stress and the anxiety that comes with those situations, I really felt that kind of put me on a trajectory to work more in that area. Also understanding that maternal mental health is so very important in attachments, and knowing firsthand how those broken attachments can impact relationships, not just between mom and baby, but family dynamics. And so I really thought that the best way to be proactive is to start in the womb. I mean, to really help moms feel better mentally and emotionally, to hoping with a goal of improving those attachments and I mean, we already know that there's so much research to suggest that untreated depression and anxiety during pregnancy affects the developing fetus. So if we can minimize that, I mean, we're creating healthier people.
Right. And the attachments, talking about that, that's something that you're familiar with. With your own mother not being part of your life for many years now. But at Sanford, the work that you're doing is very, very close to, it's a unique situation because you're working directly with an OB-GYN, right?
Right. That's what makes us most unique is that I am in the OB-GYN clinic. So I work side by side with the OB-GYN team and also with maternal fetal medicine. So I think it gives patients more direct and timely access to the mental health care that they need. And what's nice about where I'm at is they really support this idea of integrating behavioral and mental health within the physical health clinic. I mean, that these are not separate areas, that they really are connected.
Yeah.
So that's really what makes us unique.
Like I was saying earlier, before we started recording, that when a woman is pregnant, or when she's thinking about getting pregnant, when she gets pregnant, she's carrying her baby, she has the child, we're thinking about how's the baby, is it healthy? Is the mom okay after the pregnancy or the birth? But we don't often think about her mental health. Is that fair?
Yeah, I mean, I think we still have a lot of work to do with that, or in that area. We are very focused on baby's well-being, and we're really good at taking care of, baby and mom during pregnancy in a physical sense. But 1 in 5 moms will experience postpartum depression or anxiety. And that, there are a lot of women out there who don't even really talk about their symptoms because they don't know what's normal postpartum adjustment, or maybe they're afraid to even talk about how they're feeling for lots of different reasons. So I think we're taking small steps into improving that awareness, but we definitely have a ways to go.
Yeah.
As a whole.
So do you meet with the women even before, like proactively during their pregnancy, just to find out how they're doing?
Yeah, so I get a lot of different types of referrals. Sometimes I'll get a referral for what we call preconception planning. So let's say we have a mom who's wanting to get pregnant, and maybe she has a history of bipolar disorder or severe depression, and she wants to know, can she stay on her medications? What's the recommendation? What are her risk factors to developing postpartum depression or other postpartum concerns? So certainly we will meet with that mom and try to arrange a plan for, okay, if you achieve pregnancy, let's plan on giving you the support you need during that time as well as postpartum. And then sometimes I'll get referrals for moms who are pregnant and maybe are talking with their doctor and saying, I'm feeling more depressed with this pregnancy. I'm feeling more anxious with this pregnancy. Maybe it's a high risk pregnancy situation where they're working with maternal fetal medicine and they have a baby who is likely going to be born with some serious complications, and they need extra support during that time too. So it's not just postpartum. I think we use the term postpartum a lot, but it's really perinatal, which means anytime, during pregnancy or after in that window.
How much does the depression and anxiety and any kind of stress affect the child a woman is carrying?
Well, we have a lot of research to support that it can affect baby's brain development. It can, there's one study I was just reading about that had mentioned that the brains of infants who are with a mother who's depressed look very similar to the depressed mom. So, I mean, it really affects attachment, even whether it's in the womb or postpartum. So it does have some physiological consequences on the developing baby. So that's why it's so important that moms get the help that they need.
Are you finding that it's hard for women to talk about it? Like, do you have to get them to talk about it, or are we getting to be a more open society and talking about our feelings and our concerns and fears?
I think, like earlier, we still have work to do in challenging the stigma, especially. But I think that when moms come into my office, I think for the most part, they're pretty open. I mean, once they recognize that they're not alone in this and that this is something that's not their fault, and they're able to see, here are the signs and symptoms, and they see themselves in that, I think that they feel a sense of validation, and it's like they have permission to talk about really what they're going through without judgment or fear.
We hear about postpartum depression a lot, but there are other illnesses that you mentioned to me earlier that I hadn't heard of, that I think it'd be good to talk about and shed some light on.
Sure. I mean, we kind of use this umbrella term, postpartum depression. And certainly there is the depression piece of things, but really a lot of what I see now is anxiety, and not just excessive worry, but even more significantly, what we call postpartum OCD, postpartum obsessive compulsive disorder, which for women who maybe have a history of OCD already, they are at an increased risk for developing worsening of these symptoms during pregnancy or in the postpartum time. And it really looks like more intrusive thoughts that are really scary and disturbing to that person. So oftentimes moms don't want to talk about them because they are scary thoughts and they feel terrible for having these thoughts. But they could be things such as, fear of harm coming to their baby. Maybe they don't want to walk by a staircase because they have this horrible vision of their baby falling down the stairs. These are images that are just really distressing, but they can't control them. They pop up in their mind and they can't get them to go away. They might try different behaviors to get them to go away. I know that there are some moms that I've worked with who don't even want to be around their baby because they're so fearful that they will hurt their baby. And they absolutely wouldn't, and they feel awful for even having that thought, but they will intentionally avoid their child because of these fears. So that's a really severe form of anxiety, and that's what we call more postpartum OCD.
OCD, it sounds different than like the general OCD that we hear about.
I think most of the time when we think about OCD, we think about someone who's really picky about keeping things clean and orderly, and certainly that can happen postpartum too. You might have a mom who's like obsessive about sanitizing the bottles and spending a lot of time doing those activities, so much that it's interfering with her life. So it can kind of come in different shapes and forms, but I think the key thing is that these thoughts are intrusive and they're really disturbing. They're distressing to the individual.
I would imagine distressing to even say out loud.
Definitely, yeah. And I think a lot of times you have to ask the question specifically, are you having any scary thoughts? And most moms who I ask that question to know exactly what I'm talking about.
And what are their thoughts or their concerns over these?
Well, I think they sometimes feel that, oh my gosh, are people going to think that if I have this thought, I'm actually going to do it? And that's one of the things we try to help that mom understand is just because you think it doesn't mean it's going to happen. And you are not a bad person for having these thoughts because they are not your fault. It's really biochemical a lot of times. So one of the treatments being medication along with therapy. But helping that mom understand that, it's certainly not something that you would actually do.
You also mentioned postpartum psychosis.
That's very rare, yes.
Okay.
So the thought is maybe 1 in every 1,000 live births. So that postpartum psychosis is a psychiatric emergency. These are moms who, within a day or a week of giving birth, develop a lot of significant psychiatric symptoms, not sleeping, delusional beliefs. They might have thoughts of harming their child, but they're not distressing. So it's very rare, but I think it is something that we do need to keep on our radar because it does happen.
Again, is that something that you have to be intentional about asking?
Definitely.
Yeah.
And I mean, there are risk factors for postpartum psychosis as well. So when I do a clinical interview or an intake, I want to know that person's history and to get an idea of, is this something that we need to be mindful of in the early postpartum time frame?
I have to tell you that I don't have children. I haven't been pregnant. So this is really a foreign subject for me to know what a woman experiences in all of this. How do you connect with a woman in whatever space she is in, and meet her where she is at that point, whether it's before, when she's considering, or she's maybe had a miscarriage, or I mean, you probably see all of it.
There's such a wide range of moms that I work with. I mean, I know it's a kind of a narrow focus clinically, but there's such diversity within that. So yeah, I mean, just looking at every mom as an individual, and every person that I'm working with, whether they're not a mom, maybe it's just the woman I'm working with, they have their own history, they have their own experiences that brought them to the point of us meeting. And so it's important for me to know their story.
Getting back to your story, your relationship with your mom ended early in your life. How does the relationship with the women that you work with, the relationships with their moms, come into play in any of what you do?
It's a very common topic in therapy. I think that the becoming a mother, you can't really help but to think about your own relationship with your parents. And for some of the women, their moms are not in their lives either. Maybe some of them have lost their moms for whatever reason. Some of them maybe have great relationships with their mothers and are still in their life as being support people. But again, a lot of women come in with histories of trauma around those early relationships with their parents. And so I think you can't help but to think about those things and how it informs your parenting, and maybe even some of the worries that you have about how you're going to raise your children, or how you might want to do things differently.
Everybody says, we become our mothers, right?
Some people are afraid of that. I get a lot of women who are pregnant or have children who just are terrified with the thought of becoming their mother. Maybe their mother was really critical or abusive or not supportive, and they worry that, what if I am the mother that I had? But I think that awareness is really important, because I think having that insight to know what, if a feeling comes up and you start recognizing, oh, this doesn't feel good, where does that come from? Does it come from some of those old relationships? Is it more of a habit kind of feeling? And that awareness, then you can change.
Yeah.
You can change your approach and how you cope with that.
Which also kind of circles back to your story, that you've changed your legacy for your own girls.
Yeah, I mean, that was really my goal, is To, to fix the broken attachments that were on my mother's side of the family. I think that it's, my mom had a story. She had her own trauma leading up to making the decisions that she did. And you can't go back and change those things. But moving forward, I think that all women, no matter if, this is pregnancy related or not, all women have a choice to create a new legacy, to not have to carry the trauma forward.
Yeah, I remember from the interview that we had for the story, you talked about how we can choose to suffer or to move forward.
Yeah, I think, pain is a part of life. It's hard to deal with sometimes. It feels like it's never going to end. But I think that we do have a choice to say, I'm going to carry this trauma with me and I'm not going to let go of it. I'm not going to work through it. Or we decide that, I want something different for my life. I want something different for my children's life or for my partner's life, for my own life, and to make just that awareness that we can change things.
One of the things I think that would be most painful as a parent would be having a miscarriage or losing a child to SIDS or losing a child in any way. But how do you work through those situations with women and their partners?
Yeah, those are unimaginably difficult situations. And I think unless you've experienced that, it's hard to even imagine what it would be like. And I share that with the women I work with, that there's no way for me to understand the pain associated with the loss of a child. We can only imagine how awful that is. And I think there's so many different ways to cope with that grief. There's a lot of support resources that we have in our community for that. But I think sometimes just being present with that person in the midst of their pain and grief is all we can do sometimes, is to be a non-judgmental person for them to be around and to feel like they can express their grief, to create a holding environment for that.
Yeah. What about when they decide to have another child after that experience? That must be scary.
Yeah, that's I do have some experiences working with moms who have had those kinds of losses and the anxiety and the fears that they have around their birth, their upcoming birth, or the days postpartum. And so it's a lot of helping that mom work through some of the catastrophic thoughts, some of the worry thoughts, but also acknowledging that the anxiety and the fear, these are valid feelings to have, and to help be with them as they process that and get through that journey. It's a really special experience to see them get through that difficulty.
And what do you tell them when they're not seeing you and they're having these feelings? They should talk to somebody. And
for moms who aren't maybe in therapy? Yeah. Definitely reach out. I think that there are a lot of therapists in the community that can help a woman get the support that she needs. And not just the woman, but the partner too. Partners, we can't forget, are affected by these things as well. So definitely seek out for help.
Because I think it's, correct me if I'm wrong, but I feel like it's pretty common to, when you have these feelings, not want to tell anybody because of fear of, like you said, judgment or shame, or, I'm feeling this way and I shouldn't.
Yeah, there's a lot of that invalidation, that self-invalidation, that I need to just get over it, or I need to just get through it, or even, I've heard moms say that, they have a subsequent healthy pregnancy, healthy baby, and they should suddenly be just okay. And that is a myth. I mean, some of these things they'll never get over. They're going to be painful parts of their lives, and you need support through that. And support and help is definitely available.
Yeah. Leo, something I have learned about you, just getting to know you, is that you love what you do.
I do. I'm really passionate about it.
Yeah.
Yeah.
Can you tell us more about just that, like your passion for it?
Well, like I said, I think that where I'm at today kind of came from so many different directions just leading up to this point. I mean, I think there was a professional shift in wanting to be more proactive in preventing mental health issues down the line, combined with just being able to see these families get healthier, get stronger, these moms feeling more confident, seeing moms get to the point where they learn and know that they have value. It's so rewarding to see that positive change. And that just makes me even more passionate about it, is because I feel like there's so much work that gets done in therapy, and these moms are able to leave thinking, I got this.
Mm-hmm.
I can cope with this. And if we can affect one family that way, then that's pretty awesome.
It is pretty awesome. And that's that legacy
Yeah.
because then they're a better mom to their child. And
Right. And that's the goal I mean, it's a lofty goal, but I think it's good to have high goals.
Mm-hmm. Absolutely. I agree. What do you see for your girls?
Well, they're both pretty special. I'm a little biased, though. I just want them to know that they are always loved, that they came into this world, although it was challenging. I'm not going to lie. The pregnancies were difficult. They were stressful. The births were, not ideal, but they came into this world, and I want them to feel safe. I want them to feel secure. I want them to feel that they know that I'm always going to be there for them as long as I can help it, and that they have people in their life that love them.
Mm-hmm. Having difficult births with them, will you hold that over their head like when they're teenagers
No.
and say,
Because it's not their fault.
You hear parents do that sometimes.
Yeah, no, it's definitely not their fault. And they came into the world. I mean, I had a great OB. I had just amazing support during that time. So,
And did you experience some of the postpartum depression?
Yeah, definitely. With my first, especially, and I didn't really know if what I was experiencing postpartum was normal or not. I mean, I think I have this intellectual knowledge of it, but the actual emotional experience of it was pretty challenging. It was a difficult pregnancy also, but my second pregnancy was even harder. I had a lot of complications with that pregnancy, and actually made the decision to start on antidepressant medication in my second trimester because my anxiety was just so bad. I was having so many panic attacks, and working with my doctor decided to start the medication, and I'm so glad I did because I think that helped me prevent postpartum depression and anxiety this last time. So that was a good choice.
Proactive.
Yeah,
right
I was
there.
trying to be proactive.
It just seems like it's more common than a person might think.
Oh, it is. I mean, and like I said, I think that women either they kind of downplay their symptoms, or they downplay what's going on because we have this myth in society that moms should just have it all together, that we should look perfect, we should just get back to normal, that we shouldn't be stressed, we should just be so happy that we have this baby. And the reality for most women is that it's a really hard adjustment. And sometimes it's so hard that, they're really struggling and they don't want to say anything because they don't want to not appear perfect.
Lea, thank you so much. I'm so happy that you are the May cover girl and that you shared your story with us. I like to end each podcast with this question that's a tagline for Inspired Woman. She believed she could, so she did. I'm wondering how that applies in your life at any time, previously or now.
Well, I think that in some way that tagline has been a part of my life from the very beginning, from learning how to walk again to believing that I could go back to school, go to grad school, and now believing that I can make a difference in people's lives. So I definitely believe that's true.
Absolutely. And you're making the impact. Definitely. The readers are responding and enjoying your story. So thank you for sharing it.
Thank you for sharing my story. And I hope that I can be helpful.
The Inspired Woman podcast is sponsored by Quantum Productions, the home of the award-winning director and cinematographer Nolan Johnson. He creates unique high-end video products throughout the Midwest. You can check him out at quantumprond.com.